Thank you, Madam Chair. I want to talk to you about something that I think is actually one of the greatest health issues here in this country. But I want to say for the record, and then I think my colleagues will follow this up, the public should know that Mr. Trump fired the government's entire pandemic response chain of command while in the White House. But I'm not going to get into that. I want to ask you a couple questions. Would you agree doctors should not lie to their patients?
Doctors should provide truthful information to their patients.
All right. There's one. And doctors should give full information to their patients. All right.
No, you said doctors should not lie to their patients.
Yes.
I agreed with that.
Okay. They should give full information.
If they're in a statutory system that precludes certain information or certain communications, then they have to comply with statutory.
Okay, let's get that. So what? So let's talk about the contradiction, really, of those two statements, because I'm going to talk about Title IX. I'm sure you anticipated that. And listen, I also want to say thank you for being here.
Excellent.
Okay. Title 10. That's right. I can't even read my own paper. All right. So the Trump budget, Title 10, you keep it stable funding, $286 million. And I want to say something about Title 10. It has in the past been a bipartisan and very incredibly effective program. And it's meant to ensure people who are struggling to make ends meet, who don't have health insurance, they can still have access to birth control, cancer screenings, STD testing, and treatment, as well as annual exams. Unfortunately, in March of 2019, HHS published a rule which prohibits providers from providing referrals for abortion, even upon a patient's request, and impose onerous physical and financial separation requirements, which under rule, all abortion activities must be physically and financially separated. So let me just say this. I call this the Trump abortion obsession. For example, even if a patient who came into a Title X provider said, found out they were pregnant and had asked, do I have an alternative, whether I keep this pregnancy or not, the provider is not allowed to tell them. Not allowed to say. They are gagged, G-A-G-G-E-D. They're gagged. Because of this, Planned Parenthood announced it would leave the program, and unfortunately, the courts have upheld the administration's rule. Planned Parenthood served 1.5 million of the 4 million Title X patients, and I'm not going through all these statistics, but half the patients who rely on Title X funding do not have the provider they had been turning to. I want to ask you this. Do you have a list, or could you provide us with a list of the new providers that have come into the program?
I believe we could.
Okay.
I think
I would like to. Do you happen to know how many new providers there are?
The number of new, I'm just looking to see if I happen to have that here. I don't believe I have just the exact number of new providers, but we could get that for you.
Okay. Would it have surprised you that as of 1 year after the rule was published, there had only been one new provider, and the provider did not provide contraceptive services?
Well, actually, the provider, I know the entity you're speaking of, that provider has to, through their subgrantees, have subgrantees that would provide the full range of contraceptive services required under Title X.
And there are several states that have no Title X funding right now. Well, I could go on and on about this, but let me ask you another question. Who should decide whether or not someone brings a child into this world? Who is in the best? Should someone have to call the governor or call you or call me?
So with regard to Title X,
Yes.
we are enforcing the Title X law, which by Congress prohibits referral for abortion as a method of family planning, and our final rule actually was upheld even by the Ninth Circuit.
Abortion is a medical service that is legal. It's legal. Is that correct?
Congress decides where federal money may be used in connection with abortion, and so the statute in Title X prohibits referral to programs in which prohibits referral.
I do understand that, and as a result, because it's what is called as a gag rule, which means providers cannot give their patients all the information they need to make important decisions. You have lost the biggest provider in the country, which is called Planned Parenthood. Are you aware that Planned Parenthood does a lot more than refer to abortions or provide abortions, STD exams, mammograms?
So I'm actually aware that between 2020 and 2010 and 2015, 141 Planned Parenthood clinics have closed, that over the past 9 years, cancer screening and prevention services at Planned Parenthood declined by over 60%, contraceptive services declined by 30%, and important preventive activities like HPV vaccinations and well woman exams account for less than 10% of their activities as they focused on their abortion work.
Hundreds and hundreds of thousands of patients were taken care of by Planned Parenthood. Mammograms, STDs, contraception. You need to check. All right, sorry about that. I would say you should go back to school. All right, we're going to get back to our last subject. So I want to correct what I think was some misinformation that you put out, or maybe a spin. I want to tell you about Planned Parenthood. Its last report, 2.4 million patients, 9.7 million services provided, over 4.7 million STI testing and treatment, 2.6 million birth control information services. They estimated that approximately 400,000 unintended pregnancies were averted, over 500,000 breast exams and pap smears, and 1.2 million people reached through education and outlet. So I would say, and I think most people in the public would say, that Planned Parenthood has done a really good service, especially to poor women and women of color in this country. And your administration has basically, with what we call, with a very, very cruel gag rule, so putting the gag rule on steroids. And what does that mean? Gagging. It's like they put a piece of cloth across the doctor's mouth, because I think we need to all understand that federal money is never used for abortions. And Planned Parenthood has never used federal money for abortions. Oh, you're going to get the little red sticker from somebody there. But the fact of the matter is, now, with the new gag rule on steroids, a provider who does not use federal money for abortions cannot even tell somebody, when they go into office, if a patient says, what are my options? They are now gagged. The provider is gagged. And what Planned Parenthood has done, which I think is very courageous, but unfortunately I think it's going to maybe hurt a lot of women, is they've said, we are not going to be untruthful with our patients. We are an organization that if a patient comes in for care, we're going to tell them the truth. And I wanted to give you another example of the alternatives that are being provided in this country. And now that Planned Parenthood has had to withdraw. In Louisiana, the state lists of alternative providers include dentists and nursing homes. And in Florida, it includes school nurses. In Ohio, it includes food banks. So I would just, I'm running out of time, but I'm going to end up by saying this. The women and the girls in this country, we need to be in charge of our own bodies in order to have full, productive lives, not Donald Trump be in charge of our bodies. And with that, I yield back.